The next presentation, Carl, please feel free to share your slides.
Good afternoon, everybody. I'm going to be doing the presenting, but Carl is on the call to help with questions, perhaps, as they arise. So can you see my screen okay there? I can't see it any longer, so...
Yes, thank you.
Okay, lovely. So thank you for the opportunity to present findings today from a programme of work on international recruitment in adult social care that been carried out by myself and several colleagues in the Health and Social Care Workforce Research Unit at King's. So in this presentation, I'm going to give you some brief background on immigration policy and workforce trends since 22 to 26, with a whistle-stop tour of 3 studies within our programme and a focus on the most recent work, an evaluation of the International Recruitment Fund for adult social care for 2022 to 25, which we carried out with Carl. And I'll finish with summarising the intended and unintended consequences, perhaps, of these arrangements. So many of you will be familiar with the immigration and adult social care workforce interface, but some may not. So here's a brief recap. In February 22, an exception was made to the UK's skills-based immigration system, which allowed people from other countries to come and work in the UK and apply for a health and care worker visa. This exception was in response to the highest vacancies on record in the adult social care sector. So for employers and in adult social care and people seeking work, this means having to navigate and comply with immigration systems and the Home Office and UK VI visas and immigration, as well as the usual requirements of UK employment law and the costs associated with both of these. For example, an employer needs to be registered and obtain a sponsor license, and the worker needs to apply for a visa once they've been offered a job. And this job needs to be offered with a specific rate of pay, which is above the national minimum wage, and a guaranteed number of hours of work, which is pretty much a full-time job. The processes have been described by complex by many that have undertaken them, and they are guided by a code of practice rather than being legally binding. The graph on the right is Home Office data that shows the monthly visa applications since the introduction of the visa. And I'll draw your attention to the purple and pink lines. The purple are the applications by main visa applicants, and the pink are their dependents. And you can see the initial popularity of the visa. It's evident from the steep rise, which is then followed by sharp drops, which correspond to specific policy announcements. Firstly, in early 22, when there was an announcement that dependents could no longer join main applicants who were already, for new main applicants, those in the country could still continue to bring their dependents. And then the later drop with the announcement of the white paper last year in July, Restoring Control over the Immigration System, it was called, which pretty much ended new visa applications from abroad. Also widely reported is the impact of international recruitment on the adult social care workforce. And you can see that vacancy rates have returned to pre-COVID and Brexit levels. And this has been at a time when domestic recruitment has fallen in adult social care. So the contribution of international workers is actually higher than the overall percentages indicate here. Alongside the vacancy reductions, we've had improvements in retention, which is linked to the length of visas that are issued, which are typically between 2 and 5 years. The workforce has become more diverse. International workers are more likely to be younger and male and ethnically diverse, obviously, than their domestically recruited counterparts. But these improvements have been coupled with increases in exploitative practices, which has led to some employers having their sponsorship licenses revoked or cancelled, causing providers to close. And in 2025, over 470 care providers lost their licenses, and over 40,000 international workers had lost their jobs. They are often described as being displaced, and this in part is because it is really difficult to know where they are when they are no longer linked to their employer. Okay, this very busy slide summarises our programme of research alongside these policy developments. And we've been commissioned by DHSC to carry out 3 studies, and our qualitative work has provided rich insights to provide insights from sort of key stakeholders alongside the figures that I've just presented. The phase 1 study was called the Visa Study, and it's been presented at this forum back in 2023 and captured the early views and experiences following the introduction of the immigration changes. And then phases 2 and 3 have evaluated a fund, the International Recruitment Fund, which DHSC has made available as an annual non-competitive grant since 2022. And it's been distributed to partnerships at a regional and sub-regional level across England to develop and support local activities that are related to international recruitment. So our phase 2 study evaluated the 23-24 grant, which was aimed to support ethical international recruitment and employment practices. During this time, partnerships established different configurations, and they were effectively led by local authorities, care alliances, regional ADASs, or Skills for Care, or a combination of these organisations. And phase 3, our most recent work, evaluated the International Recruitment Fund for 24-25, and that fund aimed to support displaced workers to be re-employed in adult social care and to tackle exploitation. So over time, you can see the funding has shifted from recruitment of international workers to responding to exploitative practices and to try and retain the workers already in the country to remain within the sector. A key mechanism in the last phase of work I'll just flag now is the setting up of a mailbox system. I'll talk about this in the findings. And this mailbox system effectively tried to match workers who had lost their jobs, excuse me, to care providers looking for work. But of course, this relies on both parties engaging with this infrastructure. This slide gives an idea of those who have contributed to this programme of work, and it's important to say people have been really keen to talk to us. We've recruited an opportunistic but very diverse sample of care providers and international workers, all partnerships in receipt of funding across England, as well as sector experts and those working in the brokerage space. And I'll refer you to the reports for more details on these samples than I have time to present today. So I will move on to the findings, which I will do by stakeholder group, starting with care providers. I'm going to attempt a brief summary of the early phases of work and focus on phase 3, and with supported quotes from phase 3 as well. So what have care providers made of this? In the early work, they described the decision-making that was involved in deciding whether or not to recruit internationally. For some, there was no choice, their businesses would fold otherwise, and some had successfully recruited and very much valued the work ethic of international staff. Others, though, were deterred by the processes, the complexities and the cost of the immigration processes, and they required and sought support on navigating this space. We also identified different models of international recruitment, particularly in terms of who paid for what cost. Some costs were quite clearly prescribed to one party or another. Others fell into a bit more of a grey area. We came across examples where recruitment and immigration costs were being passed on to people who were looking for work by their future employers and brokers, clearly illegally, as well as instances where employers paid the cost that workers were eligible for, such as the cost of visa and others in the grey area, really to secure staff that they desperately needed. In phase 3, which as I mentioned, focused on supporting displaced workers, Care providers were encouraged and then required to use this mailbox system, but most reported quite limited awareness of this system and only really engaged with it when the policy demanded that they change their usual practice. And recruitment via this route was quite low at the time of our work. It has changed since, I must state. Some providers raised concerns about the suitability of displaced workers, particularly a shortage of female workers, those with driving licenses. Some were concerned about language proficiency, and in some cases, their interest and commitment to care work. Some also reported limited suitable vacancies, particularly in terms of having full-time hours and being able to pay the rate of pay required by the visa. Specific challenges of home care were highlighted throughout our work, particularly being able to be responsive to fluctuations in care demand. And most cases of lost sponsorship have been in the home care sector, where providers haven't been able to meet the requirements of sponsorship. Providers, however, were really keen to highlight the important contribution of international workers, and they expressed concern about not being able to recruit from overseas for the time being. And they also reported having to manage the continued tension between workforce, which were effectively on different rates of pay, terms and conditions between domestic and internationally recruited workers. So here are a couple of quotes. These describe care workers' sort of broad views on international recruitment and the impact of a small number of providers who are misusing this opportunity. So what we get as a business is the ability to pick up referrals, and in a timely way, we can always meet the capacity demands that are required. Without sponsorship, I could honestly say a lot of our businesses wouldn't survive. Our industry needs these workers so desperately. And everyone was affected, even people who were following exactly the proper guidelines according to what the Home Office wanted. All of us now, they stopped everything because there was I'd never seen such abuse in my life like we had. I dealt with the people that had been in situations, and I was like, how can another person, another human being do this to another person? How do you actually get someone from overseas knowing very well that you don't have anything for the person? Okay, on to international workers. These participants reported the sort of well-known push and pull factors that determine people's reasons to migrate for work, for opportunities for themselves and their families, and wanting to move away from countries with poorer economies. But the opportunities of the visa come with significant cost, and most workers arrived in debt, which was difficult to pay off on low wages, particularly due to the high cost of living and working in areas such as London and the south of the country. Workers described a spectrum of experiences from positive and supportive to ethically questionable and exploitative, and the inherent vulnerability of being dependent on your sponsor, not only for employment, but to remain in the country was evident in their accounts. Over time, though, care workers have reported a better understanding of what costs are appropriate, their employment rights, and their increased confidence in raising concerns. In our most recent work, given that our sample was those who had experienced exploitation and who were displaced, it was not surprising, but nevertheless shocking, that nearly all international workers reported negative experiences being financially exploited, both in their home country and in the UK, and receiving limited or zero employment hours from their sponsors in the UK. These individuals had been sent details of this mailbox system in their letter from the Home Office or UKVI. And we know, however, that from partnerships that the majority of workers who were displaced did not contact the mailbox, presumably because they were fearful of engaging with official organisations or being displaced. But the small number that did, reported receiving a prompt response, support with employment, and importantly, support with welfare and legal advice, as without income or recourse to public funds, many were experiencing extreme hardships. A very small number were successfully employed via the mailbox, but others had found jobs themselves within adult social care or elsewhere. And there were particular challenges for men and those who didn't drive. They also reported ongoing exploitation in the UK, for example, being asked to pay for new sponsorship and particular policy loopholes around the 24-hour rule, which I can come back to if we have time within questions. Here are a couple of quotes. First worker was still looking for work, second had found a new sponsor, and it was reflecting on some of the inherent vulnerabilities of being dependent. So we came here with all this kind of hope, you know, and then we come here and it's a different story. There is no work. We come with a lot of energy trying to make ends meet and to improve the lives of our loved ones, with that kind of energy to work, you know. And here we are many months now without work, and we are not eligible to work because you can't get another job when you don't have a sponsor. I think international employees, when they come here, they do not have proper information of how the system works. So the first person to give you the information when you come in is the employer. The same employer who is wanting to manipulate you for lack of knowledge is the one who you are solely relying on for the information. Okay, and finally, moving on to the partnerships. It was evident that dedicated funding was essential for the partnerships to be able to establish the infrastructure, the additional capacity, and this very specific knowledge of immigration that was required to support adult social care, especially in parts of the country where there was little or no previous experience of international recruitment. And the partnerships really valued the flexibility in how they could set themselves up to do this work. The blue map on the side shows differences in levels of international recruitment across the countries, with the highest in the south east and the lowest in the northeast. In the phase 3 work, really, it's important to acknowledge the scale and the breadth of the challenges that partnerships were asked to respond to. So matching displaced workers to suitable vacancies and responding to welfare concerns was a really significant pivot from their original ask, which was to support care providers to recruit ethically. In this change of work, they had to shift to working with a broad range of cross-sector stakeholders across the third sector, for example. Partnerships reported that job matching was variable and low, and in some areas even zero at the time of our interviews. But when it worked well, it was when partnerships had good links with the adult social care provider market. They had screened both the displaced workers and the providers to make sure that both parties' needs were met, but obviously this was time consuming. What they were particularly frustrated by was the lack of accessible data which linked sponsors to workers and care provider quality, and they were doing this themselves. They were also frustrated with having to respond to rapidly evolving policy and the impact of this at local level. There were mixed views on whether international recruitment worked better at a national or a regional level. Workers were willing to relocate and were increasingly using digital platforms to find work. But at a local level, the knowledge on support options for care workers and their relationships with the care providers really helped them manage the impact of license revocations. And partnerships also described how they work preventatively to avoid future revocations, not only supporting a sort of a wider group of displaced workers, but supporting providers with their business planning and to make sure that it aligned with the terms of the visa. Just one quote from the partnerships here to try and sum it up. International recruitment has solved the problem, but unfortunately they're ripping off the plaster before the wound's healed. We haven't solved the issue as to why people aren't working in social care, and the only way we're going to solve that is with more money. Okay, to sum up very quickly, this huge programme of work. It is evident that international recruitment has been beneficial for vacancy rates, improved retention and the diversity of workforce, with the obvious impacts on care delivery and availability, but this has been accompanied with a significant rise in exploitative and unethical practice in the sector. And the extent and impact of exploitation reported in this programme of work has been substantial and troubling. It's important to highlight the specific challenges in home care, which has the highest vacancies in the sector, where the variability in demand poses challenges for both employers to be able to guarantee the hours and meet the terms of the visas, and there are additional vulnerabilities for lone working for international workers. The need for greater parity in terms of pay terms and conditions across the domestic and international workforce adds to the long-standing workforce problems in adult social care, alongside a declining interest in the domestic labour market. And finally, just to say, we think policies that deter people from moving and staying in the UK may put further pressure on the workforce shortages and the availability of care to those with care and support needs. But this is clearly an evolving space, and we anticipate the pending reforms in adult social care. So important to just acknowledge our funder and the disclaimer that the views expressed are those of the authors. I must acknowledge my colleagues, several colleagues in the unit at King's over the programme of work, and the study participants who shared their views. So thank you for listening. I welcome any questions.
Thank you very much, Kalpa. That's very, very interesting work. So thank you very much for sharing this with us. We have a first question in the chat from Jose Luis. To what extent do these findings vary depending on the country or region of origin of the worker? So are there any differences?
Well, oh, my screen's gone blank. I didn't do anything there.
You could try probably also to stop sharing your...
Yeah, okay, let me do that. First of all, okay. There we go, that's better. So even though this was an opportunistic sample, I should say our sample reflected the countries, the main countries from which people had migrated, on which there is larger data from the Home Office. And they did vary in terms of their skills and experience. There was, very broadly speaking, people who had moved from Southeast Asian countries commonly were qualified as nurses, had a lot of experience in caring within the health sector, and they were moving to the UK, perhaps some of them with a longer term intention of moving into the NHS, but were very happy to get used to working in the UK by working in adult social care, and brought a range of experience with them. There were a lot of, in our more recent work, there were more people migrating from the African continent across many of the countries across Africa, some of whom also had a lot of professional care experience. But in those that we spoke to, they also were qualified to degree level, had very good English. Some of them were looking to work more broadly in the UK, perhaps beyond the sector. There was a range of experiences across the countries. So, yeah, I hope that answers your question, Jose Luis. Peter, I can see your hand is raised.
Florian, you're on mute, I think.
Sorry, Peter, yes, you go.
I've lived abroad for about 14 years. I had the pleasure of, my father worked in Africa. I do think it's time we get away from domestic and international. We're all workers together. And I think some of those issues you were saying with the international workers are the same as domestic workers as well. And I think that siloing of them into the two different categories has a big impact and creates a lot of issues with regard to it. My question, you put in a statement there, you raised the issue of the only way to solve this, or one of the things, was money. And what about creative thinking? What about the huge amount of young people that are in schools that have not got jobs and targeting those? I mean, I'm a member of the age-friendly community in Dorset. There's a lot of care homes that are engaging there and doing some quite big improvements with regard to community engagement and third sector. So those schools, but having the incentives, so I agree with you, you know, housing, stuff like that, you know, it's just that creative thinking. It just seems just not to be even being thought about.
I agree with you totally, Peter. I think there's just a limit to what detail I could go into in this presentation, and the providers very much talked about the pressures on domestically recruited workers. You know, the pressures to fill in additional shifts when they perhaps didn't, you know, really want to, but they felt the pressure to step up when there were workforce shortages. So I think I've just separated them out in this presentation, which because it's so specifically about this international experience, and that it is important that they were on different pay rates, which were higher than the national minimum wage. And that does create tension when you've got a new worker at a higher rate of pay than somebody who perhaps has been working for decades with that provider. But yes, it's one part of the jigsaw in terms of improving the attractiveness and the retention of this workforce in this sector. So, yeah, thank you.
Thank you. Another few questions from the chat. What's this? One question was on whether you have one or two examples of good practice from specific regions which work best in supporting displaced workers to find new sponsors. And I think also related to that is another question, if you have any recommendations from your research for the regional hubs to how displaced workers can be better supported into back into work.
Yeah, there were plenty of good examples out there. It helped if the partnerships had good links with adult social care providers beyond just those commissioned by the local authority. And so Care Alliance-led partnerships really had very much broader reach than those that were local authority-led. They worked, some of them had very good engagement by offering reimbursement for costs related to immigration costs. Arguably, this created a little bit of tension because different partnerships are offering different amounts of reimbursement, and perhaps that needed some thought going forwards, but that really helped offset some of those initial costs, which went into thousands of pounds. Other partnerships helped address some of these challenges that were picked up around language proficiency, really helping workers who, you know, they're required to have a particular level of English when you apply for the visa, but there's language associated with working within the health and care sector. There's language to deal with family and relatives, as well as managing accents and local colloquialisms around the country. So there was a lot of adaptation that partnerships helped workers with, as well as just the settling into a new country, navigating your way, which there was very good support provided by many of the partnerships. Does that cover all bits of the question? I'm sorry if I've missed a bit. Please.
Just to add to that, because I interviewed a lot of the all of the workers in the first round, and there were some really nice examples of really good caseworkers. I can't think of a better term. People who really went above and beyond for individual workers that we'd spoken to, and they described them in really glowing terms. I mean, I don't know if these people are available in every local area, but there were certainly some warming examples. But I think it requires a lot of time and casework. I mean, almost like social work, I suppose, that level of kind of involvement with some of the individuals.
Yeah, thank you very much. So last brief questions. A quick question from Val. Were there differences in findings between those switching from other visas while in the UK? So could you pick up on that?
We did have examples of, we spoke to dependents who were working without any really sort of restrictions on the hours of work, which was spoke volumes really. But we spoke to people who moved from student visas who'd had some experience of care work, because you could do up to 20 hours whilst you were a student. And so they were actively choosing to move into the sector, and that was a sort of a route that providers looked to recruit from. We also had examples of people moving or really looking to move from home care into care homes, which was just a much more stable environment and a supported environment in terms of their peers. So there was quite a bit of switching. People were also looking to move across the country, quite notably to areas that were more affordable. So there was quite a lot of movement across the programme of work. We saw this happening increasingly. And so the new employer didn't have to deal so much with the pastoral support of adapting to the country as time went on. So there was, you know, a lot of shift in that over the course of the work. And the early work, you know, people were describing the intense adaptation they had to do on arrival.
Yeah. Thank you very much. Thank you. Very helpful insights.